Good morning, everyone. Thanks for joining us for another episode of our COVID Conversations. I'm Scott McCammon, President and CEO of the Milton Chamber of Commerce, and today's topic is Let's Connect for Mental Health. The pandemic has caused a lot of challenges for business, and companies have been reinventing themselves and trying to keep their employees with them and keep their customers with them. But through all of that, there's been another big challenge that I think for the most part has gone kind of not undiscovered, but untalked about. I don't think mental health is something that we've talked enough about, and so we're going to fix that this morning. We're going to talk about connecting for mental health during the pandemic, and we're very fortunate to have two great speakers with us today. Aisha Siddiqui is a job developer at Stride, and Stride assesses the labor market and the skill level of candidates, locates employment opportunities, and matches job seekers with employers while ensuring a good fit. And Aisha has been working at Stride for over a year, but has 5 years of experience in the not-for-profit employment sector. And we also have Melanie McGregor, who is a health promotion and advancement specialist at the Canadian Mental Health Association Halton Region Branch, which provides mental health and addiction community support and education. The Canadian Mental Health Association, CMHA, which was founded in 1918, is one of the oldest voluntary organizations in Canada. And each year, CMHA provides direct service to more than 100,000 Canadians through combined efforts of more than 10,000 volunteers and staff across Canada in more than 120 communities. So as you can tell, we've got two great speakers with us today, and we'll get things underway. But first, a reminder again that we're going to have a question and answer period. At the bottom of your Zoom dialog box is a Q&A section. So please fill those in. We're going to wait until the presentations are over, and then once Siddiqui is finished, we'll take some questions, and then we'll ask Melanie to speak, take some more questions, and then do a full Q&A at the end. So with that, Aisha, I'll turn it over to you.
Thank you, Scott, for the wonderful introduction. Good morning, everyone. So today I'll be talking about mental health, and thank you for connecting with us to talk about mental health. I will be talking about Stride and the services we provide to help you cope with the new normal. For nearly 40 years, Stride Employment Services has been supporting employers who recognize the contributions that individuals living with mental health and addiction challenges can make to the workplace. According to stats on CAMH website, in any given year, 1 in 5 Canadian experiences a mental illness or addiction problem. So if we think about the stats during the COVID, it's safe to say that the number could be much higher. We help individuals join supportive organizations with a variety of job readiness programs, as well as on-the-job support. Our services include Employment Connection Program, Youth Employment Program, Employment Peer Mentoring Program, and our pre-employment services that also includes job development. Our services offer job seekers assistance with their job goals through workshops and one-on-one support with their employability needs, job retention, and coping with mental health challenges at work. And our job developers support community employers by assessing business and hiring needs, helping with onboarding of new employees, job coaching, and training. Our offices are located in Georgetown, Milton, and Oakville. Respecting the social distancing and safety of our communities, For now, all of our services have been moved to over the phone, email, and video conferencing. So how can we help? As I mentioned earlier, we would like to support you to cope with the new normal. And our staff, our employment peer mentors can provide collaborative and person-centered services to help manage mental health during the pandemic. Our job developers can support your hiring needs now and in the future. Here are some helpful links from CAMH, Government of Canada, Mental Health Commission of Canada. These links will be provided to you later on. And here are our contact information. So Aisha Siddiqui, that's me. I am a job developer at North Halton that covers Georgetown, Milton, and Acton area. And Jen is our South Halton job developer, and the South Halton covers our Oakville and Burlington. We do offer some support in the Peel region. So if you have any questions, please feel free to reach out to us, and we should be able to help you. Thank you very much. And now I will gladly answer any questions you may have.
Thanks, Aisha. If anyone does have any questions, just throw them into the Q&A box. And if not, then we'll just carry on with Melanie's presentation. So just wait 1 second to see if anyone has any questions. I think we're good. So Melanie, we'll head right over to you then, please.
Hi there, everyone. Just give me 1 second. I will share my screen here. There we go. Oops. There we go. Okay, good morning, everyone. And thanks so much to the Milton Chamber of Commerce for having me on the call today. So as Scott mentioned, it's been a while now that people have been talking more about mental health, which is great, but I find just during the pandemic, it's becoming even more of a hot topic as people are starting to realize, this whole situation is really having an impact mental health wise. So I'm going to talk a little bit just around mental health tips in general during the pandemic, and then I'll cover off a few resources that we have at CMHA and some other ideas if you or anyone you know is looking for support. Oh, hang on here. There we go. So one thing that we can start talking about is what are some things that we want to keep in mind for our own mental health and wellness during this time. So really, I think what a lot of people are feeling around this time is loss. Our Aisha referred to it as the new normal. The world has kind of been turned upside down. And so, yeah, well, we may be grateful that we have the opportunity to work from home or that we're safe and well, our loved ones are okay. We may also be feeling a little bit of loss from the things maybe that we would like to do in our life that we're not able to. And so I think one of the first things that we can do to really cope best is accept that we are having those feelings, because often we may feel, oh, I'm feeling lost, I'm feeling bad, I need those things to go away. And if we take a step back and say, you know what, this is how I'm feeling and that's okay, acknowledge that this is a difficult situation. If we can accept those feelings, then the focus becomes more on how do we cope with those. And also our feelings are complex, so things can coexist. So we can be grateful that we're safe, but also disappointed maybe that we couldn't celebrate our birthday the way that we would like to. So those feelings will definitely coexist. Self-care. This is at CMHA, we just talk and talk and talk about self-care because it is so important. So self-care is whatever we do to keep ourselves healthy and well and help us cope. And self-care is always important, but it becomes extra important during times of stress. So whether that's looking at, are we eating well? Are we keeping a good sleep schedule? Are we building in downtime as much as we can? I know it's a challenge. I'm working from home with, a young son at home, and, my husband's off work. So there's a lot going on in our house. So it's a question of building in that downtime, because I know for my own self-care, that's something that's really important, is to have a little bit of quiet time. And even when we're working from home, it can be tempting to keep working and not build in those, that quiet time, that time when we can do that self-care. So it's really important to do that. Also, we want to really look at our media and how we're using that. The amount of information that's being thrown at us these days is just absolutely overwhelming. So I'd really encourage you to look at how much news are you taking in? Where are we getting that news from? Just because information is available doesn't mean that we need to take all of it in. So really check in and say, hey, I'm feeling a little bit overwhelmed here. Hey, that's a time to maybe take a step back a little bit. And we want to be informed, but have those reasonable limits as well. And also focus on what you can control. I'm hearing a lot of talk, from people in my life saying, well, my neighbor's doing this and she shouldn't be doing that, or she's wearing a mask or not wearing that, or whatever it is. People are very focused on what other people are doing. But again, with so much going on, we can very easily become overwhelmed. So it's really a question of focus on what we can control. And what we can control is what we do. We can't control what other people do. We can't control the timeline of this whole situation. And we want to let go of those expectations of normal. Again, as Aisha said, we're in a new normal. So focusing on, well, I used to do this, or things used to be that way, often that's just going to contribute to stress and anxiety. Some other things that we can do, stay connected. We want to be physically distanced, but not socially distanced. So we can still have video calls, text, phone calls, whatever it is. We want to make sure that we're staying connected with people. Set and keep meaningful routines. So whatever that means for you, if it's you and your family maybe did, like I know in my family, for example, we always watch Survivor on Wednesday nights. Now Survivor's done, so we're having to find a new meaningful routine, but it's even keeping those things. So even though, again, things have been turned upside down, what are those little things that are meaningful that we can continue just to bring some connection to what we did before this whole situation? And we want to be reasonable with our expectations of ourselves and others. It's very expected that our mood could be affected, that our motivation may be a little bit different. And so we want to be gentle with ourselves and also gentle with other people. We really want to believe that we're doing the best we can. And communicating about what we need, whether that's with partners or friends or our employer, just saying, this is something that would really help me. Could I flex my time today, or could I this or that, whatever it is that we may need to help with our wellness, not being afraid to have a conversation about that. Now, how about supporting other people in our life? What can we do, whether it's coworkers or employees or family and friends? What are some things that we could do to support other people's wellness during this time as well? Well, one of the key messages that I'm really trying to remember is that recognize, well, this is affecting everyone. It is not affecting everyone in the same way. So we may see people reacting in certain ways and say, I don't really understand why they're reacting that way. They seem very stressed, or maybe they're not stressed when we might expect that they might be. But really, we don't know what others have been through. And so situations will affect us very differently. So we don't want to assume that everybody needs the exact same thing during this situation. So know that people will have individual reactions. Believe that people are doing the best they can as well. And validating people's feelings. That goes along with, accepting that it may affect people in different ways. So we may hear people talking about being stressed or being anxious or whatever it may be. And so one of the most important things that we can do is really communicate that those feelings are valid and that they're important. So someone may be saying, you know, hey, I'm really stressed about such and such. Even if we don't understand those feelings, we can still say, yeah, I hear that this is really difficult for you, or yes, this is a very stressful situation. Often that's what people want most, is to feel heard and to know that people are listening to the feelings that they have. And even just asking what we can do to help. And that may be very different for different people. It may be, you know, hey, I'm running to the grocery store. Could I pick something up for you? Or how about we have a call, you know, every Tuesday at 6 o'clock just to check in. Those little things can make a big difference for people. But again, we don't want to assume that we know what people need. It's asking, you know, is there something I can do to help? That can make a big difference. And another question that we're getting a lot is, yes, we're saying that it's very normal to have our mental health affected during this time of immense change. But how can we tell maybe when those changes have gone beyond what we might expect or what we might see in a day-to-day situation, and maybe suggest that a little bit of extra support might be helpful? Well, one thing to look for is really look at the changes that you may be experiencing in your mental health. Are they disrupting your life? You know, are you having problems doing the things that you might like to do because of these changes in your mental health? Now, again, some changes are going to be expected, but with those regular mood fluctuations that we all have each and every day, generally we can function through those okay, and they don't cause a lot of impact in our day-to-day life. But it's really looking at, do I feel like my life has really changed in ways that I find challenging because of what I'm experiencing? Maybe the way that you would usually cope, those ways aren't really helpful nowadays, or maybe you don't really have coping strategies. You know, you're not quite sure what to do in order to cope. Even if, yeah, sure, maybe you have people in your life, but we're not necessarily comfortable talking to, you know, family members or partners or whoever it may be. That doesn't mean that there's anything bad about those people. Just sometimes we may not feel comfortable opening up, and we may want to look somewhere else. And really, just if you feel that you want it, there's no kind of checklist around, okay, I need to hit these things in order to be able to talk to a counselor. It's, do you feel like you could benefit from talking about what's going on, maybe building some coping strategies? I mean, you are your own expert. I hear it a lot from people. They're saying, well, I don't know if I'm bad enough to talk to a counselor. It's like, you know, even the very fact that you're considering talking to a counselor means that it's probably going to be helpful in some way. And also just know that you're not alone. There's lots of people who are going to be struggling, and really any of us, pandemic or not, will be in situations where chances are the support of someone else is going to be helpful. I would highly doubt that anyone on this call has lived through a pandemic before. So we're all figuring this out as we go along. And so it's a new situation. And so sometimes a little bit of extra support may be helpful. So in terms of us at CMHA, if you're not familiar with us, I know Scott talked a little bit about us at the beginning of the call. So at our CMHA Halton Region branch, so we help people improve their health and learn more about mental health and addictions. So some things that we can do to help. So we provide support around what people may be experiencing, how they can maybe cope better. We provide information about community services. You know, often if people are experiencing mental health or addiction problems, there's chances are going to be lots of other services that may be helpful. So we can provide connections to those. We provide crisis support as well. We have a 24/7 crisis line, and we help people learn more about mental health and supporting others through courses and workshops. Now, we have changed our service during the pandemic, so our courses and workshops are currently on hold. We provide things like mental health first aid and suicide intervention training, but we're looking forward to when we're going to be launching those live again. But our other services are being provided virtually over the phone or through video calls. So what are some things that are being offered right now? Well, before this pandemic, we offered free walk-in counseling 4 days a week throughout Halton. But now that our offices, our physical offices are closed, we are providing that as call-in counseling. So it's available Monday to Friday, and we've got a phone number there that's up on the screen. So if you call that number, You'll either reach a counselor right at that time, or you can leave a message and a counselor will call you back within 24 hours, Monday to Friday. So this is free, there's no referral, there's no appointment necessary. Just, hey, I want to talk to someone. This is a really great place to start. So counselors can talk about what's happening, hopefully help build some coping strategies and talk about other resources that may be helpful. Our 24/7 Coast Crisis Line is available there as well. That continues to be available 24/7. And just in the past week and a half, we've launched some virtual peer support groups. So on our team, we have 3 peer mentors who are people who themselves live with mental health or addiction problems. And so they provide kind of a different support in a different way. So they've launched some fabulous groups. So they've got one called Just Breathe, which focuses on mindfulness and meditation. There's a recovery planning program. There's all kinds of great stuff. So I put the link there for our website, and those are being done by Zoom. So you register ahead of time and get the Zoom link. So those are some fabulous resources. Now, so we do something called case management, which is where our team members will meet with people one-on-one to talk about what they might need to improve their wellness. So again, these services are being provided virtually at this time, but there is a centralized intake called OneLink. Not sure if anyone's heard about this, but someone who's looking for mental health or addiction supports will start first by calling OneLink, who will ask them some questions and really figure out what is going to be the best support for you at this time. It may be CMHA, it may be another organization. So that's a really good place to start as well. So the phone number for OneLink is there. And I've also included just our general information line. Often people will call and say, hey, I need information about this, or this is what I'm experiencing, or where can I get support for such and such. Our door is never the wrong door. That's a lot of what we do, is talk to people around, hey, this is something you may need, and here's how you can reach out. So you can definitely give us a call. And lastly, a couple of online tools that may be helpful is there is an excellent program called Bounce Back, which is available through CMHAs across the province. And it is a program that's designed to support people who may be experiencing mild to moderate symptoms of depression, anxiety, stress, worry. So it's absolutely free, and it's a phone coaching program where Bounce Back coaches will talk to people by phone about what they're experiencing, maybe talk about some coping strategies, and there are exercises and workbooks and things that they can provide to kind of build those skills in between the calls. So actually there was some additional funding from the government that was pitched into Bounce Back as part of the pandemic support, recognizing that people may be needing that kind of support. So great program. And also there's some apps that are listed there as well. You know, let's use the technology how we can. There's some really great ones there that can be good for meditation or breathing exercises or whatever it may be. So really great tools out there that we can use. And there is our contact info. So check out our website for a complete list of our programs, but the crisis line number is there as well. And then the free walk-in counseling number we covered off earlier. So great place to reach out for to counselors. So that's just, yeah, a few general tips to keep in mind and a bit about what we do at CMHA. So happy to answer any questions that we've had. I see that there's one that came through.
I'm going to try and paraphrase that for you, Melanie. So,
yeah, that would be great.
First of all, thank you both to Melanie and Aisha for your great presentations. We appreciate the time. And as I said at the beginning, you know, this is a very challenging time for everyone. I think a lot of us went into this thinking it might be a week, 2 weeks, and here we are months later. So it's caused a lot of stresses that people just didn't even know that they might have. In this particular case, the question that's coming in, there are a lot of people, Melanie, you touched on it too, a lot of people at home that have to balance kids and work and family and everything else. They may have had a specific routine where, you know, they would get up in the morning, exercise either at home or at the gym, do some reading, and then start the workday. But now, we can't get out, so there's no exercise, or they're exercising differently, and their workday is interrupted, so they can't even have a full workday. So there are a lot of stresses. Some people are self-employed, so it's a bigger stress too, because if you're not working and making those phone calls, making those touch points, then your income can be affected. But at the same time, there's a guilt that you should be helping with the family. So all these worlds are colliding and making it very difficult for everyone. And I think a lot of people, are kind of even moving beyond what will be a normal stress into a greater tension and stress. So what are your thoughts around that?
I mean, yeah, it's a whole new world, right? And there's additional things to balance now. I think if we're working from home, or, there's financial issues there as well. So I think, one thing to talk about, maybe just communicating around what is it that I need. Again, I think, Scott, what you mentioned about guilt, if we're home and there's other family members around, or kids or whatever, we may feel like, oh no, I should be doing this, or I should be doing that. But I think it's, first of all, recognizing that we're balancing a lot of things right now at this point. And I think it's a question of, one place to start would be communicating with either your employer or family or whatever it may be around, this is what I need. I really need to take a vacation day. Or, to a partner, it's, I really feel like I need to go for a walk for half an hour just to have a bit of time for myself, and then I'll take over when I get home. I think part of it is giving ourselves permission to do that, because often we feel like, okay, I need to do it all, or I should be able to do it all. But I think it's recognizing, again, that if we're inundated with demands, that we don't want self-care to slip so far down that list that we're then not able to care for those demands. So I think it's partly communicating about what we may need, giving ourselves permission. Also maybe being a little bit creative and maybe switching up our routines a little bit in terms of what we might do for self-care. But also recognizing if it's, I just feel so tapped out right now that I don't even know what to do to cope, that may be a good time to think about maybe, say, reaching out to the free calling counseling, because often something that's really helpful even about that situation is it's a chance for you just to talk about you. This is about you talking about what you need with the counselor, and that in itself can be really helpful, just being able to open up. But yeah, recognizing that it's challenging and things are going to be different, but trying as much as possible to check in around what we really need, and asking for that and giving ourselves permission.
Yeah, and with the chamber, we've been trying to do as much as we can with Zoom calls and having virtual networking. So trying to make sure that our communities would come together and try and support one another, whether it's our young professionals, business after hours, breakfast club, things like that. And I think that's been important to do. But Melanie, you're talking about something that's a little bit different too, because while it's good for us to have socialization on a virtual scale, that those private conversations and the counseling could be very important to help people cope.
Mm-hmm. Absolutely.
So we've had another question come in, dealing with stresses caused by family members on different sides of the ways to stay safe. For instance, even the issue of mask, yes or no in terms of causing challenges. Some people feel they really want to be stringent in following the guidelines, but other people are bending the guidelines, and that's true within family units, but it is also true, with neighbors and friends and other people that are in sort of that gray area of following the rules, but not really, not to the point of a Trinity Bellwoods Park, but something in the middle. So how do you balance that with trying to follow the rules yourself, but still being a good family member or a good neighbor?
Yeah, there's so much talk around that. People say, well, I want to do this, is this okay? Is this not okay? So I think, yeah, people are interpreting those things in different ways. But I think it's for ourselves really looking at, okay, what do these guidelines mean for me, in my life, and how am I going to communicate that to other people? I was talking to a friend yesterday whose partner was saying, well, I think we should go do such and such, and she's not really comfortable having that visit with people. So it's causing a lot of stress and a lot of tension. So I think it's just knowing what we're comfortable with and then communicating that to other people. So if we say aren't comfortable, we want to follow the guidelines, and a friend says, well, why don't we, do such and such? We're not going to be 6 feet apart, but that's okay. I think part of coping with that stress even is having an answer prepared for people around, saying, look, I'm really not comfortable with that. Instead, how about we, have a distance visit, or how about we whatever. I think it's, again, getting the information that we feel we need to make an informed choice, and then communicating that to other people, and, not apologizing for that, because again, a friend may say, again, we don't necessarily know how other people are approaching this situation. If someone's saying to us, well, come on, you're overreacting, or that's not a big deal, or you should or shouldn't be doing this, it's recognizing, okay, we're our own expert, and that we're all doing the best we can. So I think it's not being afraid to speak up for what we're comfortable with, and communicating about what we're doing at this time, and exploring alternative ways as well. So it's not, if a friend says, do you want to get together? We're not saying no. It's just, well, hey, instead, how about we do a video call, or how about we, whatever it is, coming up with those alternatives.
Aisha, that might, as businesses start to emerge from the pandemic, we're moving through different phases as companies can open. The world is changing again for the good, but that creates tension as well, because now suddenly people are wondering, should I be going back to work? What are the rules going to be? Again, if I think I need to wear a mask at work, but other people aren't, am I wrong? Who sets the guidelines? And so, Aisha, maybe you can talk a little bit about the stresses for people as they re-enter the workplace.
Definitely, Scott, it is a concern. I have been dealing with a lot of job seekers who are scared to even go for an interview, because what if the interviewer is not wearing a mask? What am I going to say? What if I'm wearing a mask and it's a concern? Because for interviews, we usually talk a lot about body language, all those other things, right? So it is a concern, but what I suggest to job seekers and employees is just keep yourself safe. People will understand. These are hard times, and during these unexpected times, that's all we can do.
Melanie, there's sort of a follow-up to our other question in terms of personal protection, because oftentimes where people try and keep themselves safe, they feel like they're being judged. And in some cases, they probably are being judged, and people are making it very difficult for them. So there's that group dynamic in terms of what's right for me, and what you think is right, and you're now inflicting your opinions on me.
Mm-hmm. Yeah, and I think, I mentioned that I think there's a lot of that going around, people judging other people. Oh, you're overreacting, or no, you're not being stringent enough. I mean, it can kind of fall anywhere along that guideline. But yeah, I mean, it's going to happen. I mean, I think no matter what we do, somebody out there is going to judge it in one way or another. So I think it's just having the confidence to know, okay, I'm doing what I feel most comfortable with, because if we feel like, okay, I need to change what I'm comfortable with to not be judged by other people, that's just going to add to more stress and anxiety if I'm doing something that I'm not comfortable with. So I think it's just, again, recognizing that we're our own expert, and what feels right to me may not feel right to somebody else, and that's okay. Hopefully everyone is following the public health guidelines that have been issued, but I think it's just having that confidence to do what we feel is right for us. And if other people are going to judge, again, it's having that communication ready. So, even just saying, look, I hear that you think that I'm overreacting. I'm doing what I feel is best for me, and I'm going to continue doing that.
When we talked at the beginning of the show about, watching the news and getting information, I think the challenge too is that, even just with the PPE, the health guidelines, they change every day. Partly based on what's happening in the community, but also as we're going through the different phases of reemergence from the pandemic. And the interesting challenge, I think, is that everyone suddenly has become a public health expert.
Yeah.
Everyone feels that they're fully informed, and they're the only ones that are fully informed, and now they can pass their philosophies on to you. So for Melanie and Aisha, if you wanted to pick up on that, I mean, what kind of challenges are there now as suddenly people are the semi-qualified experts?
Go ahead, Melanie.
Oh, okay. Sorry. Yes.
It's okay.
Yeah, I think it's, again, informing ourselves. I mean, I think it's true. Anyone will say, well, this person said this, or I saw on Facebook that, blah, blah, blah. So I think it's really making sure that we're getting our information from reliable sources. And, there's nothing wrong with having discussions with people. If someone's saying, hey, I heard that, we need this, or we don't need this, or whatever, it's really taking in the information that we feel we need in order to make an informed choice. And again, if someone doesn't agree with it and they're going to make a different choice, hey, that's, again, something that we can't control. But it's a question around making informed choices based on reliable sources of information. But I mean, I think that judgment is going to be there no matter what, and it's unfortunate. But again, it's looking at, chances are everybody is doing the best they can. Aisha, did you want to add to that?
Yeah, I agree with you, Melanie. I believe, I think you hit it on the head, that mental health is very personal, and if you want to keep, you're your own expert, like you said, and if you want to keep yourself safe, then you should be doing that. It is hard because some judgments can bring up a lot of conflict, and times are already so stressful that we don't want to, we want to stay away from that. But again, the most important thing is to follow guidelines and be safe. Yeah, that's all that we can do at the moment.
I think there's also been a little bit of a group dynamic within the community because, unfortunately, some people have been laid off or have lost their jobs through the pandemic. And so, they're coping with trying to keep themselves busy. And then they're, the people that are still working and then maybe are working twice as hard as they were before. So there's that natural tension between groups, and some of those are within the same family or within the same friendship groups. So there's some stress and some guilt caused around, the different things that are happening through the pandemic.
Absolutely. I mean, we're all having very different experiences. So it's, someone who's been able to keep their job and, keep their income, chances are they're going to have a very different perspective than someone who maybe wasn't able to do that. So I know there's all kinds of opinions around, well, this service should open and this shouldn't open, and why we're going too fast, we're doing too slow, going too slow. There's all kinds of different opinions around there. But again, it's everyone's individual experience is going to be very, very different. But it's, as Aisha said, it's around keeping ourselves safe and really following what are the directives. That's all that we can really control in this situation, unfortunately.
And for the people that are tuned in, just a reminder that we are recording the show. We'll have this posted, and we can also post the PowerPoint presentation. So if you missed any of the phone numbers or any of the links, then those will be there for you as well. I'm keeping an eye on the clock. I don't want it to take too much of everyone's time, but if anyone does have any other questions, feel free to post them. But if not, then I think we'll just kind of go into closing comments, and maybe Aisha, will start with you and then go to Melanie.
Sure. I have provided our contact information. Please feel free to reach out to us, and we will be able to support you, whether you are a job seeker who's looking for a job, whether you are dealing with mental health issues, or an employer who is looking for employees to hire. And lastly, I would thank Milton Chamber of Commerce. Thank you so much for the opportunity. And hopefully we keep on talking about mental health because it is affecting us during these times a lot. Thank you.
Great. Thanks, Melanie.
Yeah, and I echo what Aisha said as well. And recognizing too that, this situation is very difficult. So I know talking about, well, we need to ask for what we need, or, we need to speak up for ourselves. I know that those things aren't always easy to do. So we're all doing the best we can. Each one of you is doing the best you can. And that's really what we have to continue to do, to stay safe and healthy, but also recognize that, this situation is not easy. And so while we're protecting our physical health, we also want to think about our mental health and recognize, maybe we do need a little bit of support. So whether that's some additional self-care, whether it's, having different conversations with people in our life, or whether it's, seeking out some professional support. One resource that I will mention, and I just realized I neglected to put it on the PowerPoint, is the Mental Health Commission of Canada. They are the ones who they own the mental health first aid course. Not sure if anyone's taken it, but it's a 2-day course that talks about how do we recognize signs that someone may be struggling with their mental health, and then how do we have a conversation to provide further help. Now, all those courses are on hold, but they've developed a 2-hour virtual course that's called Caring for Others. And it's free. It's just talks about some of the basic concepts, similar concepts that we talk about to mental health first aid. So if you go to mhfa.ca, that's the mental health first aid website, you'll see there's a tab at the top that says courses. If you click on there, you'll see descriptions of that course, because again, when people talking about how do we support others, that's a really great tool and a really great option to build some skills around this kind of stuff. And again, it's free. So highly recommend that. There's courses happening each and every day. So definitely check that out if you're looking for more, to build more skills there. But definitely keep the resource information in mind, and don't be afraid to reach out if you're looking for further support.
Well, that's great. Thank you both for all of your information, all of your help. And I know the people that have tuned in are very appreciative. We've had some nice comments coming in. There is one question that has come in, so we'll just deal with that one quickly. Is this the right venue to ask about support for children? So I'm assuming the person is asking if they can ask a question. So I would say if you want to ask the question online now, feel free. I'll try to make it as generic and anonymous as possible. If not, then we can connect you with Melanie and Aisha after.
I think that's another question people are having too, is not just ourselves, how do we cope, but what about our kids? How do they, this is a huge, massive impact on them as well. I mean, their routine has been turned upside down too. So a couple things that I'll just throw out there. I think it's, again, that validation. I think with kids, I think that's always great with everyone. So kids may be talking about, I miss seeing my friends, or I miss going to school. We may assume, wow, kids don't have to go to school, they must be super happy. But, it's a change, right? And it's a challenge. Their routine has been thrown off. So just even being willing to have those conversations and validate, just, I understand it's really difficult for you to not see your friends. And being really creative about how we support them. Also keeping in mind that Kids Help Phone is available. It's a national hotline for kids support. And also Reach Out Center for Kids, or ROC, is the local children's mental health organization, and they're providing virtual supports at this time as well. So that's an option too. And even just asking kids what they need. Sometimes I think we don't give kids enough credit to know what they really need. So just say, hey, I understand this is really difficult for you. Is there something that would make it easier? And, doing what we can. And
I think sometimes people forget that I don't know if it's role modeling or what we call it, but the kids see that things are different for adults than they are for kids, right? So, parents can sit on a lawn chair on their front lawn and interact with their friends, either with a drink or not. But the kids are seeing that, and they want to be with their friends, and they don't understand. Talking to your friend from 6 feet away is not the same as playing a board game together. And so they see the adults being able to do things and coping, but the kids can't. So it just creates that stress within the family as well.
Yep, absolutely.
Perfect. So that's great. Again, thank you to Aisha and Melanie for all of your wisdom and information. We really appreciate it. And thanks for everyone for tuning in to another episode of our COVID Conversations. So until next time, that'll be our show. Thank you.
Thank you.
Thanks, everyone.